group of health experts have penned an opinion piece calling for an end to the national state of disaster. They say that daily screenings and hand sanitization should be scrapped, and in fact, so should the school restrictions. However, they've offered various alternatives to try and manage the pandemic and the gradual return to whatever normal looks like after the pandemic. Co-author of the article and director of Wits University's Ezintsha Health Services is Professor Francois Venter. He's our guest on this issue and joins us via our video line. Prof, great to see you as always. Thanks very much indeed for making time. So let's begin by understanding why you and the other experts who co-authored this letter feel that the time now to scrap these regulations has arrived.
I think that we probably felt they were due to be scrapped quite a long time ago, but they are long past the due date. All the things that need to be done around the pandemic, we have the existing legislation. The Department of Health needs to be taking care of it. It's a serious virus, it's a serious health threat, but we don't need special regulations to take care of it.
Right. What is most interesting, I think, from a lot of people will be also the call to do away with the non-pharmaceutical interventions. That kind of feels like the most drastic kind of amendment to life as we know it right now. I mean, from a health perspective and from the data's perspective, how are we ensuring that that too will ensure that we stay safe? Because obviously the virus is still with us.
So the virus is with us, but a lot of those non-pharmaceutical interventions, well, some of them just never did anything. The sort of temperature taking at the front end, it was a complete farce from the beginning. And some of the things that was done was actually against government guidelines, like fogging. Unfortunately, it was government departments that were probably the worst offenders when it came to that. But things like taking your name at the front of restaurants and all of that just needs to end now. There is a role for sanitizing, but that's to deal with the other bugs that affect us, particularly during winter, the viruses and bacteria that cause illness, but not to stop SARS-CoV-2. So a lot of the stuff that we've recommended against there, we now know the scientific, at the time we were kind of whistling in the dark a little bit because we didn't know how the virus totally spread. We thought there was much more of a transmission from the surfaces. We now know that that's extremely rare, that it's largely just from through the air. So all that stuff we do at the front end in walking through the door of supermarkets and everything where we're sanitizing and taking temperatures and taking names can end now. The schools thing is a much more thorny issue, but again, being at school is so important for child development, for child health, that the recommendation is very firm from us that we need to get children back to school by almost any means necessary. And there are very firm ways to get them back that we've recommended there, to keep them at school and to keep the teachers and people there as safe as humanly possible. Yeah,
we'll speak about those alternatives in just a moment. What's I guess, cohort's view around face masks, especially in a context where there's an appreciation that, the virus spreads through the air?
So outdoors, there is really no risk. The recommendations against face masks outdoors is we just think should be removed. It's, and these people not being allowed on beaches and not being allowed to congregate outside is silly unless you're in an incredibly close environment, thinking maybe a rugby scrum or something like that. You're not going to transmit the virus outdoors. Indoors, in between waves, for instance, in Gauteng at the moment, there's almost no virus circulating at the moment. It doesn't really make sense to be wearing a mask indoors all the time. So the idea that we're going to have to wear masks in perpetuity doesn't make sense. What makes more sense is to wait for an alert which says that that there is a wave happening at the moment, and then you might want to stop congregating indoors, and you might want to start wearing a mask if you are vulnerable. If you're in those groups of people who are particularly susceptible to the bad outcomes of the virus. But the idea that we're going to permanently be needing to wear masks needs to start being challenged now. Particularly as we start, I think what we're trying to do is to balance between this is a serious virus, but on the other hand, we do need to start getting to a stage where we are actually living with the virus while paying attention to it.
Yeah. I mean, I'm interested to try to find out a bit more how you reckon the putting on the mask and taking it off will work in a context where, for instance, by the time you get an alert, the horse has already bolted in some instances.
No, actually, South Africa has amazing early warning systems. We actually knew this latest variant was coming right at the start of it. Government just needs to get much better about warning everybody. In some countries, many countries don't have early detection mechanisms, but South Africa actually does. But at the moment, Gauteng is a very good example. There's there really is no circulating virus. It is still circulating in other parts of the country, and it's probably, particularly if you're elderly or you're diabetic, it's probably a good idea not to congregate outdoors, to take a little bit of extra care if you're indoors near people, to wear a mask that you don't know. But if you know, in Gauteng at the moment, to be wearing a mask all the time when the risk is extremely, extremely low indoors, just doesn't make sense.
The obvious question also becomes then, how do you regulate the wearing of masks or make it mandatory in a context where the legislation that made that possible has been relaxed? And I'm talking now about the state of national disaster.
So I'm not certain. Firstly, there are lots of laws in the country that are applied that mandate all sorts of things, from wearing seatbelts to wearing your glasses when you're driving a car, that are part of the health regulations and are part of just keeping people safe. So it doesn't make sense to me that we need a state of disaster to do this. But I also just think a lot of this is just is persuasion. We don't need to mandate things. I don't think people are wearing masks in restaurants and in supermarkets because the law told them to. I think they're doing it because they feel like they want to keep themselves and other people safe. And I think far more attention needs to be paid to that. I think shopkeepers, for instance, are doing that to say, look, we want to look after our own staff and we want to look after the people who are buying things. So I think paying attention more to that rather than saying that the law is what's persuading people or is forcing people is the way to go.
Prof, do you really believe that? Do you really reckon that people are wearing masks because they think that's what the right thing is, or because they actually just are afraid of reprisals in the form of some kind of either penalty or jail time? I mean, we've seen instances where people have refused to wear masks even though it's legislated. That suggests to me that in the absence of the law itself, then we might run into a lot of trouble.
Look, I think that the benefits of masks are there, but they are very, very small next to vaccination. And that's where the problem is coming, is that we are sort of making a huge fuss about masks, but particularly with this latest variant, it's just torn its way through. I mean, I'll talk about Gauteng because I live in Johannesburg and that's where I've got a lot of experience. And, when I go to the malls and I go to face masks, they may be worn badly and they may be fixed badly, but people generally are wearing masks, even outdoors. Now, this virus just tore its way through anyway. And that about 50 or 60% of the population, we estimate, actually got the latest variant. So you've got to ask yourself, well, we did all this face masking, and yet it didn't protect people. So, for all the fuss about masks, you've got to ask yourself, well, for this tiny amount of protection that it gives you, and I don't want to shame people who want to wear masks, and I certainly don't think we should be, sort of making a fuss about people wearing masks in the way that the Americans do. I do think we need to be clear that they don't afford very much protection in the face of such a transmissible virus. The biggest protection comes from the vaccines.
You speak about the Omicron variant. I mean, one of the, interesting things that I've heard experts like you speak about is this phenomenon of the decoupling of the infections and the deaths, right? And, many people actually coming forward to suggest that those are signals of a pandemic ending. Is that a sentiment you also agree with?
No, actually, I don't. I think that the signal with that is that our immunity is doing its job. In fact, as I said, 50–60% of Gauteng, and possibly as much, possibly the rest of the country, is not a pandemic ending. It's just the fact that our immunity is meaning that it's stopping us from going to hospital and dying. And that's very reassuring on the one hand, but there still were a significant amount of people who died during this wave. And we still need to be keeping a very beady eye on that, is to make sure that, if another variant comes along, are people with diabetes, are people with who are elderly, do they need boosting? We don't know that yet. What's the levels of immunity where they can at least declare themselves largely safe? And I suspect we're going to get to a stage where no one's 100% safe. But how can we balance that safety risk against getting on with our lives? And how can we make things as safe as possible for them?
All very interesting, and I guess time will tell to see how government responds. For now, thanks for your time and your insights. Really do appreciate it. Professor Francois Venter is with the Wits University's Ezintsha Health Services. Once again, thanks very much indeed.